We've experienced a number of challenges to the nation's mental health between the pandemic, the upheaval around George Floyd, and lots of other things. And we've all experienced that together. We've all had those mental health impacts. In terms of progress in mental health research, just in those last 7 years, we've seen the adoption of coordinated specialty care for first episode psychosis in over 300 clinics throughout the United States, serving thousands of individuals. We've seen the FDA approval of two novel therapies, two novel medications for depression. We've seen expansion of services in a variety of areas. It might sound Pollyanna-ish after what we've just heard, and I don't mean to be that way, but certainly we have seen a lot of progress in research in those 7 years. When we talk about, though, having our research reach people who need it, that's where we try to work with a broad variety of other organizations, some of whom have been represented here today on this stage, like the National Alliance on Mental Illness, where we've formed, they helped us form a public-private partnership for drug discovery in schizophrenia. We work with the Substance Abuse and Mental Health Services Administration, which is responsible for funding those coordinated specialty care clinics to make sure they're using evidence-based approaches there. In fact, we have a learning healthcare network we formed with them so that those clinics can learn from their experiences and figure out what's working and what doesn't work, where our researchers are embedded in those clinics, getting data from those patients and sending it back to the clinic so the clinic knows what works. We work with the FDA, CMS, et cetera, to make sure that evidence-based approaches can be approved and can be supported. So a lot of different interactions with different federal agencies.